Hello and good afternoon, everyone, and welcome to today's session. Thank you for joining us. My name is Rakesh Rai. I have been associated with Hitbullseye for around 20 years. I have been guiding and mentoring students and parents throughout my journey. We at Hitbullseye guide them in such a way that they get into their desired B school finally. With me, I have a distinguished guest for today from one of the premier B schools in India, and that is IIHMR Bangalore. This interaction will help our audiences and all the students who are participating as of now to make strategy and get some clarity about a lot of things that you might feel confused about. As you all know that to support our students at Hitbullseye, we keep on bringing top colleges and their representatives to give a better insight about the college, institution, tests and so on. To give you just an idea like what kind of work we're doing, we have been into providing quality coaching to students across various domains, including CAT. Our portal hitbullseye.com was started in 2014 as a one-stop solution to crack most of the entrance exams in India. With our unique style of curriculum and teaching process, we have generated excellent results in the past and have consistently generated top percentiles in premium exams like CAT, SAT, IIFT, IPSAT, NMAT, SNAP. Coming back to today's event, now in the process of helping students, when we thought of getting a person to advise and guide about IIHMR Bangalore, we could not think of a better person other than Dr. Usha Manjunath. She is a professor and director at IIHMR Bangalore. Let me give her introduction. She has over 20 years of experience as management faculty and has an unique experience in allied health, disability, communication, entrepreneurship, general health system management, research and academics. She is a dynamic leader with interest in behavioral science, management and entrepreneurship, academics, teaching, consultancy and research projects, training and capacity building, entrepreneurship, community, social development work. Besides publishing articles in national and international journals, she has also published a book on total quality service in healthcare in 2012 and was also awarded Bharat Ratna Indira Gandhi Gold Medal Award. Thank you, Dr. Usha, for taking out time and participating. So glad to have you here. So we are already seeing a lot of questions from students. I think I'll start with first question that we already had, because IIHMR standouts in the entire, I'll say the plethora of colleges are there, and Bangalore being hub, and I think out of top 7 cities, Bangalore plays a very, very vital role in people seeking MBA in various niche domains. So IIHMR takes place in this area. I'll ask you to talk about core specializations initially, and then maybe scope of MBA, PGDM at IIHMR. So if you can throw some light.
Thank you very much. I'm very happy to interact with you, the participants and students and prospective students from various backgrounds to take up management careers, and specifically for healthcare, where we are working. As you mentioned, IIHMR Bangalore was established in 2004. It is a part of IIHMR Jaipur society. So we have a legacy of 35-year plus in research, education and training. So our 2-year full-time program, it is a flagship program, PGDM in hospital and health management, is approved by AICTE. We have MBA accreditation for the program, and it is now given an equivalent to MBA from Association of Indian Universities. So we have 4 specializations. It's a full-time 2-year program. Here we have hospital management, health IT and pharma also. So apart from jobs and careers, there are many opportunities for the students. The scope is vast as we look at. The scope of a PGDM or an MBA in healthcare currently is very, very high. As we understand, in terms of the health sector, the growth, it is growing at 16% CAGR, and as you know, COVID also put health on the front. All the developments that are happening at the digital aspects of healthcare, pharma, for example, related areas, there is a lot of growth factor that is coming up. If we really see this sector, we sometimes refer to it as a sunshine industry. There will be always some form of requirement for healthcare needs to meet the needs of the people. So there would always be something that we have to do. Another part is, very importantly, if we look at the industry perspective, see, India is a very large country and we have resources less. So there is efficiency and those kinds of things have to be worked out. So where the doctors and clinicians, paramedics also focus on, where they themselves, the numbers are lesser than the needs of the population, but they can concentrate on the core healthcare delivery, whereas the people who come into management, administration, and various levels, they can really support the hospitals, public health, and various other organizations in really working on improving the reach, the efficiency, and so on. So there is a lot of scope. If we really see in the core industries of hospitals, public health, NGOs, there is a lot of need for these kinds of trained professionals in management, particularly in healthcare, because healthcare has its own peculiarities than general management. So therefore, it is very important to learn. For example, in health IT, our students get a lot of exposure and become domain experts, whether it is in requirements management, implementation of health IT systems into hospitals or many other programs. So there are a lot of these needs. And now there is also emerging opportunities, and in the long run, they can also look at starting their own, startups, entrepreneurship, and so on. Not only the healthcare, pharma industry, health IT companies, consulting companies, hospitals themselves, public health, NGO. There is a lot of push from the CSR and foundations now as program managers and others. So there is new areas emerging. The scope is they can further expand into, if their UG, based on their UG specialization, let us say they are from nutrition, maybe they can become specialists in nutrition and be in various programs, across, because malnutrition is very high. Or, if they're good in communication and journalism and others, there's the opportunity for, IEC, SBCC. So in the core specializations, as well as further to expand into their areas of interest, or to kind of really see into emerging areas of IT, AI, I think there's a lot of scope. This is a very emerging area, and I think young students can really consider this.
Right, ma'am. Thank you so much for the answer. And I think it gives us deep insight about because ultimately when a student, what I feel that the MBA thing comes into the mind, obviously these days, 5 years MBA programs have started. So students who are in 10th right now, they see it as an option after +2 also. Usually, traditionally, somebody who gets into first or second year, then they start thinking about getting into some MBA college, or maybe after some kind of work ex. Then this IIHMR MBA is something you talked about. This is a peculiar and different program which is being offered in the arena. Now, my question to you would be, somebody who just thought of getting into an MBA college, now at later stage, or maybe while taking admission, he got into IIHMR, seeing the program that you talked about. Can a student get into a different field after pursuing this MBA? What are the options available?
Definitely. Say, for example, in our 2-year program, like any other management program, the core functional areas of management are taught. And, they pick up everything from finance to marketing to, basic principles of management. So lots of the information they have, and then health data analytics. And before they really go into the core specializations of 4 specializations they would be doing here. So what it means is they have an opportunity be really learning management like any other MBA program also, and then they can pursue further. So when I say healthcare, like I said already, healthcare is very fast growing. It is much faster. A lot of things have changed, especially in the field of AI, ML, telemedicine, and so on and so forth, because of COVID. And this sector is, new emerging areas are coming up because, better health awareness, health needs, IT technology, pharma adaptations, international part. So all these are coming up. So the avenues is is in the healthcare, obviously related area. It's a vast healthcare industry that itself provides a lot of opportunities for them. Further, let us say, for example, in the areas of aspects of social and development sector, say for example, if they want to work in, say for example, child rights or education or in the poverty, maybe in health economics, they can continuously specialize in those areas of their interest and also take up. Like our own students, for example, having worked in the field, have also kind of grown, and the careers today is not like before where it is stuck with one. Health has a lot of social determinants and it has a lot of social impact. So therefore, lots of things that we do in the social sector is very similar. So social and development sector, international NGOs, like say Plan International, maybe UNICEF, maybe many such, Save the Children. There are many causes and many interests. So it depends on the student to really, if they are passionate about, working further, definitely there are opportunities in the social development sector, which would be a kind of a slide, but lots of the methodologies, lots of the work we do are very similar. So there is a lot of scope, yes.
So when we are talking about scope, ma'am, one question is about placements. And before we come into, before I ask you the question on placement, now we are seeing a lot of traction happening in tech arena. So a lot of opportunities are there. The kind of salaries students are getting post-COVID is phenomenal. So can you talk about something which is related to influence on placements, like after COVID, what has happened in the placements arena, I'll say, in IIHMR?
Interestingly, very interestingly, what we saw is we were also concerned, 2 years about COVID and, placements. But what happened was COVID was all about health and healthcare. The placements, in fact, our students did much better. This time, last time, we have had the fastest placements, like when we had the large group, but still we were able to really do, and the number of vacancies we generated were very high. So students had better choice, and that is because of a lot of digital aspects, startups coming up, telehealth coming up, companies like pharma really kind of growing very fast, needs of the people are really changing. So it really changed, and for all in terms of the salary packages, all that in fact increased. So I think we've been very fortunate. I mean, in the sense, of course, the other side, of course, we have had challenges with COVID, but from the perspective of the job market, we have had a very good opportunity, and it's going to continue to grow because there is going to be a lot of transformations. Whether it is in the digital space, like India saw, for example, if we see 1980s, we saw a lot of the hospital sectors grow. Private hospitals became very big growth sector for us. And now, this 2020 onwards, or even little before it started, but COVID gave it a fillip, and then now the digital health is going to really take over. So these transformations will continue. There will be always, different kinds of opportunities coming. Yes, there would be new skills that they require, and definitely they require a passion to be in healthcare. And so I think in terms of placements, we have had a very positive outlook. Our average salary has gone up, our median salary highest has gone up, and so I think there has been a very positive outlook.
Right. Thank you so much. So it's amazing to hear that that the same kind of response is there. Obviously, we had challenges in COVID. Now, when we talk of COVID, there was one industry which got impacted, that was education. And all the schools were closed, colleges were closed. Now, things are opening up. Fortunately, after Omicron, the mindset, the feel is more positive now. My question to you would be, what kind of campus life a student can expect, or they should, see in IIHMR?
Sure. Typically any postgraduate management institute, the campus life would be very similar. Even during COVID, we tried our best to engage them. A lot of things, in between when there was, a lean period, Some of the students did come back to campus, but we did everything online, convocation to their programs, to competitions and all. So we have now that they will be coming back on campus, there's a lot of positive things that we have planned up. We have a beautiful, airy, green, environmental friendly campus. So their life is going to be like a mini India. In general, about 19 to, on an average, year on year, we get students from across 19 states. Of course, 50% plus are from the southern states, including Maharashtra and Orissa, Madhya Pradesh, some of them, and North, Northeast, Western India. So you name it, you have. So it's a mini India. So they will experience the cultural diversity and have a wonderful opportunity to make friends. Learn new things about other states, and then of course we have very formal activities of extracurricular activities. Maybe sending them to seminars, conferences, paper competitions, entrepreneurship. Now we have a new cell which the students themselves are managing. So we have industry associations for talks, seminars, hands-on skill training workshops. So other than that, of course, all the festivals, all across India we do have. So life is, we provide, if they're young, they need to be really enjoying as much as they learn, make those memories and have a very positive outlook to, life and how they take it forward. And then we also have a special opportunity for us to conduct a lot of health days. So where students themselves, it could be on, various aspects of a cancer day maybe, or a diabetes. So these are the areas where they can come up with their creativity, they can apply and also learn about the health issues. And they have independent roles, various committees they form themselves, and really, and sports is also possible. So we have some of the opportunities. Then there's a gym. So cultural participation is something that brings together a lot of the people. Of course, in terms of other, we have research projects which we do. So other than the flagship program, we work with various agencies and we take up research projects like monitoring and evaluation. We have funded projects like from UNICEF and Karnataka government, ICMR and all. And these are field level projects. So, we could also kind of send them for those field level projects. We conduct other trainings to learn and to, for that they can organize event management for, healthcare related training, support us. So they have opportunities. So life is, we do give them experience. I mean, the usual of freshers maybe, or, parties. And so some of that is a part of every this one, and then celebrating the national holidays and national days. So these are all part of that. So I think, we have another program which we will do now that it is, students are going to be opening up. We have a manifest, which is a management festival with sports as well as, a lot of management competitions. And nearly 200 to 300 other management college students come here. And during COVID, obviously, we were unable to conduct that physically, but from this year on, we will also have that. So there are a lot of formal ones. We also give them a lot of space to explore a lot of things. And Bangalore is a great place, whether it is theatre, whether it is parks, whether it is sports, cultural and other things, and play, drama, theatre. So culturally also it's a very vibrant city, very friendly for youngsters. So they have a lot of opportunities.
Very true, ma'am. I think you talked about two prime components of MBA, and that is one of them is the outside industry connect that you talked about, and one thing obviously you talked about mini India. So somebody, not only because of COVID, but somebody who did their graduation traditionally in India, they stay at one place and then they go out for their PG programs or some kind of higher education outside of their city or the state. So Bangalore is obviously one of the right choice. And when we talk of this industry connect, ma'am, I would like to know what kind of internships or what kind of industry connect is the exposure they get in their curriculum, or while they do their MBA at IIHMR.
Yeah. I will talk at two different levels. One is where during the program, like say for example, our students are, some of them may come from medical and paramedical and other background, and there are about 40 to 50% who also come from, general background maybe, or engineering background, BBA, and so not necessarily healthcare. So our curriculum has built in lot of exposure visits, in coursework. We also take them to public health facilities. We take them to hospitals. So we have what is known as an observership for 15 days, where every student is associated with the hospital, and we kind of help them get that placement, and so that is like a learning part of it. At the end of the first year, we have what we call generally as internship. That is a 2-month, we call it as a summer training program at the end of 10 months. This time, last time, for example, during COVID, nearly 40 of our students, 50% of our students or more, like, we have 95, but there are some who are, very specific with their own opportunities. So 40 of them got paid internships. So anywhere between 5,000 to 20,000. So that is for the 2 months. So here they have the opportunity to convert them into jobs. Then there is a 4-month recitation internship. By then they're already placed. So that is at the end of the 2 years. So practically for 6 months, they are in the industry in one way or the other. And during COVID also, we were able to manage a lot of online internships. And then we waited when the hospitals opened, we were able to get them various opportunities. Health IT, where consulting continued with online, and so on and so forth. So we have had very good opportunity in the internships. So your other question is, how are we, partnering with the industry agencies? So for our curriculum, so that is the second part, where one part of our curriculum, we also have, university collaborations. We have collaborations with hospitals, large hospitals like Sakra Hospital, Narayana Health, Burji Hospital in UAE, Sanitas Hospital in Tanzania, many other people in Australian hospitals. And they kind of also come as guest lecturers, industry interactions, and various opportunities across. The other is where we have for health IT companies. A lot of them are around, and Health Tech Central, for example, for student training. Again, we call experts. We have opportunities for visiting faculty, guest faculty. And with the other specific universities that we have done is University of Mysore, we have even floated one certificate course in nutrition and health. Similarly, with Cloud Physician, an eICU solution provider with intensivists and ICU care, we've started an integrated digital ICU management program, which is short-term one, certificate courses. With Maastricht University, we have across the field. So if we look at universities, hospitals, health IT companies, consulting companies, other healthcare organizations, the government, organizations. So we have empanelment with National Health Authority, NHSRC. We also have a NABET accreditation for hospital, accreditation, NABH, as a consulting organization. So we have those many different ones. In terms of our recruiters, year on year, we have had Z's, Burji Hospital, Fortis, Practo, Deloitte, Accenture, Primera, Allscripts, Cognizant, hospitals like Manipal and Narayana Health. Government, NHM, National Health Mission programs of the state governments and central government. So, hospitals like Motherhood. So, of course, like I said, these are regularly, the placements are organized, and, we have many formal and informal parts with the, providing internships, placements, and observership. And so I think in terms of our partnerships, the industry has been very open. We're very fortunate, whether it is from the hospital sector to other IT sector, pharma sector. They've been very, very positive, and they also want good people to be trained. So they work with us, they help us even train some of the things for the placement and so on. So we have been very fortunate. Our partnerships have been going very strong year on year.
Thank you, ma'am. So this was really in depth. Now, my last question would be, how does IIHMR stands out in as an institution with respect to other colleges options available in India? Along with that, if you can give some insight, like what exactly you look into a student before you recruit them in your institution. From students' perspective, what they should be doing or writing in their resume, or what are the things that you look to get them into your college?
Look up onto the historical aspects of management education in healthcare in India. IIHMR has been the pioneer, and IIHMR across the board has been the top one in healthcare. In terms of students, for example, who pass out of this, and you look at across Indian healthcare sector, hospitals or public health and many other organizations, you would find an IIHMR. That is a kind of spread. Like I said, Bangalore is there from 2004. So we have had many pass out. So overall, we have 4,000 plus alumni across, and we are very well known in the sector for preparing the students for the working in the sector and so on. So that's one part. And Bangalore, of course, is recognized as the best by the Knowledge Review magazine, and weeks ranking has been very good for us. In 2021, we are the 11th one in best school. But this is not just for healthcare. So even among the general management, when we are rated very well. And Outlook has given in Bangalore the 10 again, the healthcare part, but in general management. So I would say that in terms of the industry rankings, our presence in the industry and our actually the contributions and I'm immensely proud of our students, how they are contributing to the sector. They're all their career growths have been very fast. After the first couple of years, this is a very fast growing industry, as I already mentioned. So this has been very positive for us. And how does someone who looks up to IIHMR or the healthcare MBA wants to be really positioning themselves? I'll take 1 minute to say how our eligibility and others are tried. We are AICTE approved. So we take up, any graduate with a 50% mark from a reputed university, and they have to go through, MAT exam or any of the aptitude exam and have a score. So there would be cutoff depending on the year on year, the number of applications we get, there could be cutoff. Much more than that, we look at their GDPI, group discussion and personal interview, and to be very passionate about the industry. See, healthcare, unlike others, is a little different. We work with people a lot more. Every manager works with people, but healthcare has a special this one because people in terms of the compassion, in terms of the the care, the patient care is the most important. So in terms of having that positive part is very important. To be passionate, I mean, anybody who is passionate will do very well. So the skills can be acquired. So, and having more of positive attitude would really place them really to move ahead. And I would say one more thing about about healthcare. As we grow, we all want the other part of our social conscience, our inner this one becomes a lot more important. And healthcare provides that because we are helping people. I think, from early on, they will have the satisfaction of helping so many people from young age onwards. And I think, that really gives us a lot more. When we help others, we help ourselves. So that's another part. Of course, like any other sector, we also want people to have, interest a bit in the arithmetic skills, not necessarily mathematical ones, but because now a lot of the data analytics is very important for management. and basics of understanding about and passion and communication skills, and that they should be able to speak, and so they should be able to express themselves, have a fair good amount of writing skills. But then we do take them through these pre-placement activities. We again train them on all this, prepare them very formally with various experts, various kinds of companies to really get them on board for preparing them for the industry ready and getting them prepared for their placements, interviews, and so on. So yes, IIHMR is one of the top-rated institutions, and Bangalore has its own attractiveness in terms of the weather, in terms of IT, good hospitals, and so on. So and across India, Bangalore is the place that people do come for, and so that's one attractiveness. The other one is, yes, we are very serious about the academics. We follow the parts, and we also train them. I mean, the whole idea is we have students who are coming for healthcare, and there is the part of care and compassion on the other side. So we try to kind of in these 2 years prepare them through various curricular, extracurricular, and hands-on experiences and so on. So yes, bring your passion, bring your basic skills, your basic intelligence, and you would be ready, and we would really work well with you.
Thank you so much, ma'am. It looks easy and difficult both at the same time to get into IIHMR. Now, thank you so much once again for sparing your time. We at Hitbullseye see this as a strengthening of long-term relationship with IIHMR Bangalore. And thank you to all of the students who participated in this, and IIHMR and you, ma'am, once again. It was immensely informative. And to students, we would like to really, provide you the kind of guidance that we are already doing this. So we'll really appreciate if you come forward and ask your questions at later stage. You have all the numbers of the counselors and the people who are guiding you at hitbullseye.com. And we take pride in saying this, that we do genuine counseling. Please feel free to call us at your convenient time with all of the queries which we can answer. Thank you once again. Thank you once again, ma'am. Thank you and take care.
Thank you, and best wishes to all of you. Whichever career that you choose, do it well and stay healthy and happy. All the best.
Thank you, ma'am.